Welcome to Health Tech Explorers. Today, we're diving deep into medical data, the foundation of modern healthcare and clinical research. Understanding different types of data is key to analyzing it effectively and making sound medical decisions. Why understanding data types is crucial. Medical and clinical data come in many forms. Knowing how to classify this data shapes the way we analyze it, visualize trends, and interpret outcomes in healthcare and clinical trials. Categorical data in healthcare. First, let's talk about categorical data. Information that identifies groups or categories without quantitative meaning. Nominal data. Labels or names without order. For example, patient gender, male or female, blood type, AB, AB, O, symptom presence, yes or no. Often analyzed by counting frequencies, like the percentage of patients with a specific blood type. Ordinal data. Categories with a natural order but no measurable distance between them. For examples, pain severity, mild, moderate, severe, disease stages, physical activity level, low, medium, high. Analyzed through distributions and rankings. Numerical data in healthcare. Next, numerical data measures quantities with two important types: interval data. Consistent intervals but no true zero point. For example, body temperature in degrees, date of symptom onset. Supports addition and subtraction but not meaningful ratios. Ratio data. True zero point and consistent intervals. For example, patient age, blood glucose levels, heart rate. Supports all mathematical operations, including division. Why this matters. Different data types require specific analysis methods. Misclassifying data, like treating an ordinal scale as ratio data, can lead to false conclusions and poor clinical decisions. Correct classification enables accurate visualizations, such as bar charts for categorical data or scatterplots for numerical data, ensuring trustworthy results. Key types of healthcare and clinical data. Beyond categories and numbers, clinical data for healthcare and trials includes electronic health records or EHRs, detailed patient histories, lab tests, imaging, treatments. Core to patient care and increasingly used in research. Administrative data, billing, hospital visits, demographics. Helps track healthcare utilization. Claims, data. Insurance claims capturing treatments, costs, outcomes for large populations. Patient or disease registries, collections of data on specific diseases or treatments to monitor outcomes long-term. Health surveys, population-level data on behaviors, prevalence, and health status. Clinical trial data, structured data from intervention studies assessing safety and efficacy. Combining data sources for insights. Researchers and clinicians combine evidence from trials, claims, and EHR data to understand drug effectiveness, real-world outcomes, and optimize care pathways across diverse patient populations. In the age of big data and precision medicine, mastering medical data types is essential for advancing healthcare quality and research accuracy. Thanks for watching. If you liked the video, don't forget to give it a thumbs up and subscribe so you don't miss any future videos. See you next time.